I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye care. What are we talking about today? Our question today is, Dr. Mattis, I want to get eyelash extensions, but I'm afraid since I've heard so many terrifying stories about individuals getting infections or having an allergic reaction. Is eyelash extension safe for the eyes? Well, let's debunk some of the myths, because most of the times we hear about the bad things and not about the good things. So let's talk about our eyelashes. What are they? Eyelashes are a group of the shortest hairs on the body, and they grow along the edges of our eyelid. The eyelashes are hairs, so they will fall out naturally over time, just like the hair on your head, and they grow back on their own, usually within 4 to 6 weeks. They all don't go at the same time, so you don't find that you lose them all, so they go at different rates. There's a condition called trichomegaly, where eyelashes are increased either in length, curling, thickness, pigmentation, or combination. We're not talking about that today. We're talking about how we can enhance our own eyelashes so we can have more, volume to our eyes. How do eyelashes protect the eyes though? Why do we have eyelashes? Well, thanks to our eyelashes, they operate as dust catchers, protecting the eye from infection or injury by preventing dust, dirt, pollen, insects, and so on from entering the eye. So they have special nerve endings which are highly sensitive to touch. You may recognize that, and that provides a warning that an object such as an insect or lint or dirt is close to the eye, and this triggers us to blink. So blinking is a reflex which protects our eyes. So let's talk about false eyelashes. Are they safe? Well, false eyelashes are generally safe. And the aim of false eyelashes is to have long, beautiful, and fluttery eyelashes. But there are a few risks that one has to be aware of before applying them. So let's talk about eyelid infection. One can get eyelid infection, as our question stated earlier, from applying false eyelashes. That can come about if we have instruments that are very sharp and causes some amount of abrasion or sticking when they are applied to the eye. And so what we want to ensure is that when instruments that are sharp are being used close to the eye or the eyelid, one is very careful about the use of these instruments. So I recently had a patient who actually came in because she had false eyelashes applied, and she came in with pain, redness, swelling, and discharge from her eyelids. And she said to me, Dr. Mattis, while this was being applied, I felt a sharp sticking and it felt painful. When false eyelashes are being applied, it should not be painful. And so my patient, she ended up with redness, swelling, and discharge from her eyes. And in her case, after applying the lashes, she went to the river. And so, as you can well imagine, if there's any type of abrasion to the eyelid margin when the lashes are being applied, and you go into a river where you're going to have bacteria and germs and fungi, that is setting up a situation for an infection. So we had to treat her. So the main part of this infection is going to be caused by poor application of the lashes. Now, blepharitis. Blepharitis is an inflammation of the glands of the eyelid margin. So when you have the glue being applied, if you have an allergy or a reaction to the adhesive that is being applied, you can get an allergic reaction. Now, the person also asks a question, can it damage your natural eyelashes? Of course. There are different types of eyelashes that are applied. The most natural type is the single ones that are actually glued onto your own lashes. There is the strip that can be applied, and that is, I think, more applied closer to your eyelid margin. And so when you have the strip that is being applied, when it is being removed, and if it is removed incorrectly, you can break your natural lashes and damage the hair follicles. This is less likely to occur if we use the fusion technique for false lashes. And as you know, with the fusion technique, the lashes are individually applied to your own lashes, and they follow the growth of your own lashes, and they are shed when your own lashes are shed. So that technique, I think, would reduce blepharitis because they are not actually touching your eyelid margin. Although, as I will say, remember, I am not applying false eyelashes, but I will say that even the strip should not be applied to your eyelid skin. Okay, so that being said, when you have lashes that damage your own false eyelashes, when they are being removed, damaging your own lashes, your lashes can fail to grow back, causing traction and alopecia, which is similar to what happens when hair braiding is pulled too tightly at the hairline. You lose permanently your hairline. Okay, as I mentioned before, there can be reaction to the glue, and that reaction can cause some amount of irritation because of the chemical in the glue. Now, if you are using medical grade glue, that should be less likely. However, we are all different, and so even medical grade persons can get allergic reactions. Okay? Now, one can also get a droopy appearance of the eyelids, and that occurs if too much glue is used or too many lashes are applied. Remember, you want to look naturally beautiful, so don't have too many lashes being applied because it can prevent your eyelids from opening. So if you have too heavy an eyelid, it will fail to open properly and your eyes will look like slits. So what can one do to minimize the risks of complications, if you will? Who should avoid eyelash extensions? Well, persons with the following conditions that I'm going to mention now should talk with their doctor before considering eyelash extensions. So we have a condition called trichotillomania. And trichotillomania is a stress or anxiety-induced urge to pull out your hair, including your eyelashes. So you'll find people pulling on their hair and just pulling out their eyelashes. They will have less lashes, they will lose lashes. You don't want that person to get false eyelashes because they will pull on them and make things worse. Persons who have had recurrent what we call eyelid dermatitis, and dermatitis is an inflammation of the skin around the eyelid. If you are prone to getting that, I think you should stay away from getting false lashes because it can aggravate the condition and cause burning and redness and itchy eyelids. Blepharitis. Blepharitis is a condition that exists without the use of any false eyelashes. So if you have chronic blepharitis, you are not a good candidate to get false eyelashes or eyelash extension. And then there's another medical condition called alopecia areata. And this condition, it causes full or partial hair loss on the scalp, and it also may affect the eyebrows and eyelashes. So those patients should not be considered for extensions. So I'm going to suggest to you, what can you do to ensure or to minimize complications? Do your research. Choose a reputable salon and inquire about the esthetician's training and experience and certification. And also remember, word of mouth. Word of mouth is a very, very good advertisement for anyone. If you are concerned about your skin, you may possibly do a skin test of the adhesive that's going to be used. And this more applies to the esthetician. One has to take care during the applications. As you all know, your eyes must be closed, and right through the procedure, you keep your eyes closed while the esthetician is applying the lashes. So you should not experience any pain, and if you're experiencing pain, you must inform your esthetician so they can stop. And then, of course, you have to take care when you're removing your lashes, depending on the type you use. If you're using our fusion technique, they will fall off naturally. But if you're using the strips, you have got to make sure that you use the appropriate oil-free remover to remove the lashes so you don't pull on them and destroy the hair follicles when they are being removed.
I'm Dania Moncrief, the registered pharmacist and the licensed beauty therapist behind the Oracle Salon. And today I'm going to be addressing some lash extension related questions. I define lash extensions as any method that is able to extend the appearance of natural lashes using synthetic lashes. That can describe various types of lash extensions, which include strip lashes, cluster lashes, and fusion lashes, my specialty. Fusion lashes is unique because it uses an isolation technique. We basically are able to isolate each individual hair and select an appropriately weighted extension for application. With this technique, our fusion set is very flexible and it allows free, non-restrictive growth and shedding of the natural lashes. The fusion application has specific steps and rules which must be followed in order for the health and safety of the natural lashes and the eyes to be maintained. Once a lash tech is adhering to these rules and the appropriate steps, there is complete safety and health of the eyes and the eyelashes. So loss of natural lashes is going to be happening every single day. Permanent lash loss, however, is a totally different story. We have permanent lash loss or traction alopecia occurring when there is excessive and continuous stress to the follicles of the eyelashes. If you're plucking out your eyelashes, some clients do this, as a stress release, just habitually pluck the eyelashes. Or if you're incorrectly removing your eyelashes at home, this can cause traction alopecia. On the part of the technician, if the isolation technique is not correctly done, then we can have excessive stress to the follicle. So it's important to do your research to find a qualified and duly certified lash technician and ensure that your lashes are removed professionally. The fusion lash procedure uses a special adhesive. This adhesive is a medical grade cyanoacrylate adhesive, and it's perfectly safe for the eyes and skin. It's actually used in the medical field to close shallow wounds without the need for stitches. And that's why it has been selected for the use in a fusion lash application. There are some restrictions to the use, however. We need to ensure that the eyes are completely closed during the service, during application, so as to prevent the vapors from burning the eyes. If you've seen fusion lashes done and the eyes are looking red after, that's one of the common reasons why the eyes will be red, the eyes being open. Allergy to this glue is fairly rare. I've only seen about 3 such cases of moderate to severe allergy in my almost 10 years of working as a lash tech. If clients suspect that they may be allergic to this adhesive, they can request a patch test. You basically go in for a light application about 2 or 3 days before the actual appointment, just to make sure that you're not allergic. Unfortunately, clients with moderate to severe allergy to this adhesive, they cannot receive fusion lash extension. So some things that you want to look out for with your appointment You want to ensure that your lash technician is doing a light consultation at least before your service, and it's not only geared towards the aesthetic parts of the service, but also to ensure that you are not allergic to you have not had any such reactions in the past, just to make sure that there's no risk of a severe reaction. You also want to look out for any evidence of poor hygiene practices in your salon. So you want to make sure that the work area is clean and hygienic. One red flag is speedy fusion lash services. The general time frame for a fusion lash set is about 1.5 to 2.5 hours. Anything less than an hour, that's a red flag. Some more things to look out for during your lash set. Your eyes should be closed during the entirety of your appointment. At no point in time should your lash tech be opening your eye, and you should also keep them closed during the service. You should feel nothing entering your eyes during the service, such as tapes or any moisture. There should be nothing entering the eyes, so the eyes should be completely shut. There should be no pressure applied on your eyeballs from the lash tech. Some techs work with a little bit more, they're a little bit more rough, so it should be a very gentle application process. You should not experience any burning sensation inside of your eyes while the lash tech is working. And also, you shouldn't experience any jabbing or stabbing of the extensions applied. While you won't be able to tell whether or not your lash tech is using the proper isolation technique, you should be able to brush through your lashes from root to tip with your lash wand that you will receive. And you should also your lash set should also be very flexible and lightweight. During the wear, lashes will be shedding. And once they're shedding, you want to ensure that only one natural lash is attached to each extension. When you're seeing multiple lashes attached, that's a red flag.
So, I hope these tips were useful. So I say to you, go ahead, get your lashes and step out looking like a superstar. Okay, thank you for watching, and I'll see you next month for our next insightful session. Remember, if you have questions, drop them in the comment section below. Have a nice day.